Close to anywhere between 1.7 to 1.9 million people are dying a year of chronic disease. We talk a lot about war. Since the dawn of this country, roughly estimated between 1.3 to 1.5 million people total have died in war, American lives. So in a year, we're losing more people to chronic disease than all the wars combined, and we're not talking about it.
Today, we're sharing a powerful message delivered by Brigham Buhler during his recent testimony before Congress. Brigham is the founder of Ways to Well, a functional and regenerative care clinic, and a co-founder of its sister company, Revive RX, a pharmacy focusing on health, wellness, and restorative medicine. His words to Congress echoed what so many of us are already questioning. Is our healthcare system truly focused on health, or has it become a machine for pushing medications over meaningful change? Brigham didn't hold back. He pointed directly to the elephant in the room: pharmaceutical companies' massive investments in advertising and lobbying, which push the narrative that medication is the primary solution for health issues. Think about it. How often do we see commercials urging us to ask our doctors about the latest drug, promising it'll handle everything from minor issues to chronic disease? But where are the conversations around lifestyle changes, prevention, or even simple dietary shifts? Those don't get the same airtime, and that's intentional. One of the standout moments of his testimony was when he shared some truly eye-opening statistics on chronic disease in the US. Over 60% of Americans now live with at least one chronic condition, and many of these cases could be preventable or at least manageable through lifestyle interventions. Diseases like type 2 diabetes, hypertension, and heart disease aren't just popping up randomly. They're often directly related to our choices, stress levels, and, let's be real, our environment and food system. Brigham also highlighted a major issue with the current approach to treating these diseases. He pointed out that while pharmaceutical companies profit from symptom management, there's minimal incentive to actually tackle the root causes. It's a system designed around repeat customers, not cured patients. Imagine if we redirected even a fraction of the resources that go into drug development towards community health initiatives, nutritional guidance, or programs to improve public access to whole foods and exercise. The landscape of American health could look completely different. Now, let's get into the hard numbers he shared. Did you know that chronic diseases account for a staggering 90% of the $4.1 trillion spent annually on healthcare in the United States? 90%. And yet, our medical system continues to focus more on treating symptoms than preventing the disease itself. Think about it. If our health system were truly working, wouldn't those numbers be going down instead of up? And then, Brigham dropped another bombshell about food chemicals. He explained that many food additives and chemicals allowed in the US are actually banned in other countries.
Let me show you what's in Fruit Loops in America, and let me show you what's in Fruit Loops in Canada. The same manufacturer, Kellogg's, is selling one product to the American people and a safer, less ingredient, less chemical-filled product outside the United States. They have the ability to sell it here, but they don't, because they know they can sell more addictive, more colorful, vibrant, that attract kid food sources here in the US.
It's so dark.
These aren't just obscure ingredients, they're things we encounter every day in common processed foods. European nations, for example, have taken a stricter approach, banning certain preservatives, artificial dyes, and flavor enhancers that have been linked to health concerns. Yet in the US, they remain approved for consumption. Brigham questioned why the FDA, the very organization that's supposed to protect our health, continues to allow these chemicals while other countries take a firmer stance on food safety. It's troubling to think that our food system permits ingredients that might be contributing to the rise of chronic diseases here in the US. Brigham's point about the FDA not doing enough to keep harmful chemicals out of our food supply underscores a larger issue with regulatory bodies. There seems to be a significant gap between what's allowed and what's genuinely safe.
From the food, processing, growing, harvesting, chemical treatments, to the packaging, to the ingredients we add into our food, to the hospital systems, throughout the system, front to back, the American people are set up for failure. In the 1950s, the FDA had approved 700 different ingredients in our food products. That's it, 700. Today, there are over 10,000 chemicals and petrochemicals in our food products in the United States.
Brigham's message to Congress was clear. We're long overdue for a shift in focus. It's time to prioritize a healthcare system that empowers individuals, encourages preventive care, and moves beyond simply treating symptoms. And more than anything, it's time to question why our health is being shaped by profit-driven narratives instead of real, science-backed approaches to wellness. His words were a powerful call to action, not just for policymakers but for all of us. It's a reminder that we can take ownership of our health journey, that we can look beyond the prescription pad, and that real wellness often starts with small, sustainable changes we make in our own lives. The question we're left with today is, are we ready to demand better? Please like and subscribe to the channel and leave a comment if you would like to share your thoughts on the healthcare issues we discussed. Thank you, and until next time, stay well.